Florida, we have a very diverse population spread over a big geographic area. Our hospitals deal with a population in the state of roughly 19 million people. 4 million of those people are uninsured. Another 3.3 million are covered through the Medicaid program. Another almost 3.5 million are covered through Medicare. So a high percentage of our patients are elderly, and a high percentage of our patients come from low-income families.
Participation in the Hospital Engagement Network seemed to be a natural for the work that we were doing in quality improvement.
We want to make sure that we have all the information that you need.
We had already begun initiatives in reducing preventable readmissions, eliminating hospital-acquired infections, and improving surgical care. When the Hospital Engagement Network was announced, we looked at how that would fit into our current strategy and how that would allow us to leverage the work in more focus areas and through more resources for Florida hospitals.
The HEN is probably the biggest and best organized quality improvement data, information, knowledge base that's ever been created. The data impacts us and helps shape us in a very positive way by understanding very quickly and almost seamlessly the transparency of having data that we collect and then compare and can improve on with other hospital systems is very reassuring. It gives us a feel for where we are. Otherwise, it'd be like flying without instruments in an airplane. No one would want to do that.
We've looked at the data and realized that overall we've seen a 36% reduction in our CLABSI rates since the start of the Hospital Engagement Network. Out of our 40 maternity hospitals, 39 have implemented hard stop policies. What our hospitals have found, as soon as they implement those policies, the rates of early elective deliveries drop dramatically.
FHA is particularly proud of the fact that in 7 categories, at least 60% of our hospitals have improved more than 30%. That meets the federal criteria, and we're extremely proud of that achievement.
The biggest takeaways from the Hospital Engagement Network for our frontline folks, our intensive care unit nurses, our med-surg nurses, is that they understand the data. We have posters around their units showing how many months since we've had a central line infection or a ventilatory-associated pneumonia or a urinary tract infection. If perchance we should have an infection, literally they're tears. People are very upset. And then when they find out what happened, what can we do better?
There's a certain synergy and momentum that's created when hospitals come together in large groups and you have people sharing their experiences, essentially competing with the data to improve. When folks begin to get measured, they want to improve and they look for the best and quickest way to do that. The general direction is improvement. And I think that's what makes us so excited about being part of the Hospital Engagement Network process and so proud of what we're doing here.
Thanks for tuning in to HN Daily's special coverage of the Health Research and Educational Trust's Hospital Engagement Network. This project has been brought to you by the Center for Medicare and Medicaid Innovation, the Partnership for Patients Initiative, the American Hospital Association, and the Health Research and Educational Trust.